Art Therapy Assessment number 6, Clock Drawing Assessment. This assessment actually is widely used in art therapy, but also in neuropsychology. It's super quick, non-invasive, and very powerful. So the assessment is fairly simple. It would be me asking someone to draw a clock showing 10 past 11. So part of what I'm doing is actually observing how they're drawing it, maybe the spacing of the numbers, and was there any stress involved? Did it take them some time to actually sort it out and figure out where the placement should be? And also, overall, does it make sense? So in my practice, I've actually known it to help in determining if somebody has dementia or Alzheimer's. It can absolutely be a early on telltale sign that maybe this is what an issue is, not a guarantee. There's always a neuropsychologist behind it or a neurologist that will determine if this is the outcome. But this is a great sampling, a great way to start to see if maybe there is something underlying there. So out of all the assessments, this actually becomes like a diagnostic tool for us. With that said, it is not a standalone diagnostic tool. There's other elements that need to be put in place with this. So as mentioned, this is a great diagnostic tool in detecting the following. So first would be the Alzheimer's and dementia end. Next would be TBI, traumatic brain injury, just seeing if there's any cognitive dysfunction there. Schizophrenia would show that thought disorganization, things that they struggle with when actually going through an episode or just in everyday life, unfortunately. This clock assessment can also help with depression, especially in seniors. Also anxiety disorders, it can actually stir up that perfection end of things that people stress about. Parkinson's disease, which can show, that shakiness, so that can be a telltale sign for us as therapists. So with stroke, it can actually show that hemispatial neglect, where it's like sometimes you'll see with the clock, like half of it is missing. And lastly, ADHD, where it can show that impulsivity, attention to detail, or planning deficits. So as art therapists, we will use this not only for detection, but also for exploration when working with our client. It can open up a great dialogue about memory, control, aging, and even fear that is associated with any of that. So here are a couple AI-generated images for you guys to kind of get a feel of what we're looking for as art therapists. I'm Jean, and I'm an art therapist.